The next thing, that we would look for in terms of a baby with pneumonia would be to see what the pulse rate is, and also what the oxygen saturation of the baby would be. You'd expect the pulse rate to be higher, and the pulse rate is 132 according to the pulse oximeter. I can also do that when I auscultate, and the oxygen saturation is 95%. The other things that we can do is check a blood pressure, and so blood pressures can be checked on the arm, and we apply the blood pressure cuff with the arrows pointing over the radial artery, and then we can use our regular stethoscope. We can just place that over the artery. We can pump up the cuff and then let it come back down, and we can see what the blood pressure is. And in this situation, it's working beautifully, and it's 80/55. So we were able to tell what the blood pressure was in that situation, and our baby is not in trouble with that. The pressure is up a little bit, but as anticipated. The other thing that really helps us out in terms of physical diagnosis is auscultation of the chest, and so we want to listen and see are there any abnormal heart sounds, but also what are the sounds that we would hear, and are there sounds of a pneumonia because this baby looks like it's ill with a respiratory infection. So using the reality scope attached to my stethoscope again, I can listen. In this position, I'm listening to the baby's heart, which has that slightly rapid pulse of 132. But you can hear that, and I know that's what the pulse is from the pulse oximeter. And then as you auscultate, you can hear that the baby has some ralls, which are the sounds that we tend to hear with pneumonia, especially on inspiration. The respiratory rate within a normal range at this point. So basically what we've seen is a baby whose blood pressure is slightly high, his pulse is high because of the infection, has sounds of a pneumonia, and is slightly down in terms of oxygenation, but otherwise looks stable.